Welcome to Mayo Clinic Q&A. I'm Dr. Helena Gazelka. Because cancer treatments can weaken the immune system, cancer patients are at increased risk of complications from COVID-19. But despite restrictions on the provision of elective care and social distancing recommendations, cancer patients often still need treatment, such as to go to the clinic or to go to the hospital. And many have questions about how cancer should be treated differently during COVID-19, if at all. With us today to discuss this is Mayo Clinic oncologist Dr. Tony Vasab. Thank you for joining us on the program today.
Thank you for having me.
Tell me just a little bit, is cancer care different during COVID-19?
Oh boy, yes, yeah, absolutely. I mean, our whole world has been, for medicine overall, and even outside medicine, has been transformed in many ways. And for cancer care, it has certainly gotten way more complicated. So it is different. It is different, especially in this time of crisis. It is different in terms of, patients coming to the clinic, families not able to join the patients during their clinic visits, some patients being reluctant to come to clinic, other patients reluctant to undergo chemotherapy. And my biggest concern is a lot of the patients who have symptoms yet undiagnosed, who may have cancer, that are reluctant to show up to their doctor and be diagnosed early as well. So yes, it has changed quite a bit, at least on the short term for now.
Is it true that cancer patients are at a higher risk of complications from COVID-19? And what can patients do to protect themselves?
So far, the data is suggesting that patients with cancer, and specifically those undergoing treatment, although we're not sure yet, maybe at a higher risk, actually quite significantly higher risk than the general population. It is estimated that 1 out of 100 patients who would get COVID-19 may actually suffer severe complications and die from it. For cancer patients, depending on the data we're looking at from China and from Italy, and hopefully soon we'll see some of our own data from the United States, it's anywhere between 10 to 20%. So it's 10 to 20 folds higher than the average rate of death from patients otherwise, the overall exposed patient population. The confounding factors: cancer patients tend to be older. They also tend to be sicker. Chemotherapy certainly can suppress their immune system. So what elements are working essentially to increase the risk, whether it's all of the above, whether it's mostly the chemo, their cancer, or the fact that they're older, is yet to be understood. In the meanwhile, we do have to ensure that our cancer patients do extra precautions, ensuring that they're safe, that they're social distancing, like all of us are, but even more so. They wear masks if they go in public. Their caregivers wash their hands and be careful how to care for them. The good news is that at Mayo Clinic, as other places, we are going above and beyond to ensure that all our patients are safe, but even more so our cancer patients, to make sure that they're safe in the chemo unit, they're safe when they come and see us. We also are, of course, making sure that our providers are also safe, because it's essentially the provider taking care of the patient. So everyone is making sure that they're masked, that washing hands multiple times, and we're taking every precautions for our patients to be in a safe environment.
It sounds like a lot of the things that you have in place for routine treatment of cancer patients are probably helpful in this situation. Is it advisable that cancer patients plan to continue on their treatment plan throughout COVID-19?
Absolutely, yes. And we have patients in different categories. We have the patients who underwent surgery, and chemotherapy or radiation are essentially life-saving, add to the value of the surgery in a curative setting. We do know that within 8 weeks, for most of our cancers, within 8 weeks, we need to initiate their treatment within 8 weeks from surgery. And if we lose the window of opportunity, we will lose the capacity to enhance their likelihood of cure. So it's not an optional element. It's actually a must for our patients. For some patients, it's an added 25 to 30% chance of survival. Then the question comes also to those patients who are in the more advanced setting. Is it important for them to come and consider their chemotherapy, immune therapy, or whatever modality we have today? The answer is yes. Chemotherapy is not only life prolonging, but it also provides a palliative effect. Those patients are in pain, their appetite is down, they're losing weight, they're losing energy, and essentially not starting these types of therapies for many of them, if not for most of them, will actually affect significantly their quality of life, in addition to affecting their prospect of survival. So for all these, and there are other elements as well, for all this, I think that it is important for our patients to stay on track with their treatment, whether in the early stages or the later stages.
You made some really good points. I practice both pain medicine and palliative medicine, and I often tell patients that the most important thing that I can help you do to have your pain or other symptoms managed is to work with your oncologist, because treatment of the disease is often really does relieve the pain and other symptoms. That's a really good point. What about cancer survivors, people who've completed their course of treatment? Do they still remain at an increased risk of complications from COVID-19?
We're not 100% sure one way or the other. What we know is that what we've seen from the small studies, again, from other parts of the world, is indeed they are. Now, the question is, are they continuously at risk through their lifetime, or just within a year or two from them finishing therapy? This is where I would take the stance that, you know, if I don't need to physically see the patient, I shouldn't. And you know, Mayo Clinic and other centers have invested heavily into moving in telemedicine even before COVID-19, because we knew we have to reach out as many patients as possible, ensure that they don't have to travel all these long distances to come to us. But this tragedy has accelerated essentially our understanding and implementation of telemedicine. For those patients, I'd say most of them, they don't need to come and see me every 6 months. I can actually see them, you know, by telemedicine. We have these video capacities. For some, it may be actually just a phone call. For others, it's a video, which I prefer actually the video interaction. I want to see my patient. I actually want to see them face to face whenever I can. That's the best aspect of what we do. But to protect them at this point of time, for those who don't need to be physically in my clinic, we're actually implementing those measures. They come, get their scan, they get the lab. I mean, we're even allowing some to get them locally if they live too far. I review them, and then we have the video consultation to the benefit of the patient. And then rather than every 6 months seeing physically, I'm seeing them now. I'm planning to see them every year with an interim televisit. Until we understand a little bit more, you know, what is the real risk for those cancer survivors. That said, I think telemedicine is here to stay. We planned for it. COVID-19 tragedy and crisis has accelerated it, and I think it's now here to stay.
So other than the way that perhaps surveillance and visits are conducted, is there anything different that cancer survivors need to do than someone currently undergoing therapy as far as precautions?
For all of us, I think we have to be very cautious. Elements that drive all of us right now in these COVID-19 days should apply to the cancer survivors as well, meaning social distancing, ensuring that when you're in public, you wear your cloth mask, or if you have access to surgical masks, preferably cloth masks, leave the surgical and other elements to the healthcare workers at this point of time when dire need for those. But wash your hands and just be careful. That's the best advice we can give them at this point of time until we understand a little bit more, you know, if they are indeed at higher risk. But even normal risk folks, you know, have to be careful. The same measures apply to everyone. You know, again, like I said, from the clinical standpoint, some cancer survivors, you know, still want to come and see us because they most of our patients like the face-to-face interaction. I'd say for those patients, you know, if your oncologist, your physician says, hey, you know what, we can skip this face-to-face meeting and we do telemedicine, next time I'll see you, understand that it's for your safety. And I hope you can understand that it's mostly for your safety. The other thing I would say also, it's for the safety of the other patients who are undergoing treatment, who also are much higher risk than anyone else in terms of getting complications if they catch COVID. And for those patients, we need to ensure that our clinic is certainly, at this point of time, primarily limited to those patients who really need to see us in clinic. So the less folks are physically present in the clinic, if they don't need to be in clinic, the safer the environment is for everyone.
Is there anything that the caregivers, contacts, or household members of patients with either cancer or cancer survivors could do to help reduce risk in the environments that they're in?
Yes, it's such a tough time for our cancer patients. And I understand it's a tough time also for those who care for them, because again, the loved ones, the ones that care for them are certainly at even higher stress than ever, concerned about, what if I get the COVID-19, I don't know about it, and I give it to my spouse, my father, my mother, my brother, my sister, the ones I'm caring for, and increase the risk of mortality. So that's very stressful just to think about the risks we put our loved ones to. At the same token, this is such a tough time for our cancer patients. They're isolated more than ever. I mean, I know a lot of patients, not just cancer patients, are isolated from social contact, from being able to be around loved ones. I know that most clinics, have a no visitor policy just again to protect our patients. That certainly adds to the stress of our patients. So we want to minimize how many coming and seeing the patients. We encourage them mostly to stay connected, but the ones that live at home with the patient have to ensure that they take all the measures that, again, we want to make sure everyone does. Wash your hands frequently. You take your temperature twice a day. You also, when you go out, you take all the measures to protect yourself with masks, social distancing, and others. And that's about it. And there's no need to essentially distance yourself from your loved one, the ones at least that live with you at home, as long as these measures are taken in account.
There is a lot of loneliness and people are isolated. And I thought how very different this pandemic would have been in the years before we had the virtual contact that we have with one another now and the ability to FaceTime and Zoom meeting. It would have been a really different. Thank you so much for that information. Is there anything additional that you'd like to share with us today?
Yes, I think overall, we're gonna pass through this. It's gonna pass at some point. We're gonna figure out ways to have a vaccine, to have treatments. With all the measures that we're taking now, that the impact of the virus will be minimized. I want my patients to understand that, as an oncologist, it's tough for me not to be able to shake the hand of my patient. I find myself every time I'm going to see my patient, I have a mask on. I have to start with an apology about the fact that they can't see my facial expression as well. They can't shake my hand, with the hope that the next visit or two, I will be able to show them the full expression of my face, my handshake, or my hand on their shoulders. And they're all very understanding. And I know it's tough for all of us. It's tough for us as providers. It's also very tough on our patients. We're all in it together. We're gonna get through it. The new world that will come after COVID will be a much better world for our patients, for providers, for the way we're gonna stay connected. We're gonna be much more creative, and hopefully will improve the quality of life on the long run of everyone involved.
Thank you for ending us on an encouraging note. That's Dr. Tony Bekaii-Saab here with us today talking about cancer care during the COVID-19 pandemic. Thank you so much for being with us today. We look forward to seeing you next time on Mayo Clinic Q&A.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.